This is HealthSpot TV, an informative and entertaining look into the world of health and wellness, and the positive issues which affect and enhance the way we live and enjoy our existence.
Professionally, it's affected me because there's times when I have deadlines at work and I'm sweating because I'm nervous, and it kicks in the hyperhidrosis that much more, and my fingers are slipping off the keypads. It's not very fun.
Both men and women are affected by hyperhidrosis in equal numbers, and it can affect any part of the body, but most commonly, in 50% of cases, it's the underarms, and in the remainder of cases, it's the palms and soles of the feet.
Well, from what I know, it's an excessive sweating condition, and it's really bad in my situation, or at least I think it's really bad in my situation. I sweat all day long. I can be in the middle of a snowstorm and I'll be sweating.
Hyperhidrosis is a condition that no one wants to talk about. Many of the patients simply suffer in silence because they're embarrassed about the condition, and many patients do not know that BOTOX is available to treat this in a very simple fashion. The way BOTOX works for hyperhidrosis is that it blocks the chemical that is released by the nerve endings that cause you to sweat. So BOTOX does not affect the sweat glands. It does not affect the muscles in that area. It simply blocks the chemical called acetylcholine, which is released by the nerve endings, and this chemical causes you to sweat. This
is my first time for BOTOX, and I'm curious to see how it's going to turn out. I want it to work, and I have high hopes that it will, and I just got my fingers crossed that it's going to work.
One of the ways to treat hyperhidrosis, which I feel is probably the best way to treat hyperhidrosis, is with BOTOX therapeutic. And BOTOX is a purified protein which is injected just under the skin using a very tiny needle. They're relatively painless. The thing that I like best about this treatment, especially for areas such as excessive sweating in the underarms, is there are virtually no side effects. It's one of the few procedures I do where there are no side effects other than perhaps a small bruise. The patients absolutely love it. After 3 to 7 days, the BOTOX magically kicks in and the sweating ceases. Patients should find a physician who is experienced at administering BOTOX therapeutic for hyperhidrosis. It would be advisable, in my opinion, to find a clinic that does this procedure on a regular basis so they have some experience in administering the BOTOX in an effective and safe manner. Hyperhidrosis is recognized as a medical condition by Health and Welfare Canada. Consequently, the cost of the BOTOX therapeutic is covered by most private health insurance plans, which many Canadians have.
The results have been amazing. I'm feeling so much better about having BOTOX done. I no longer have any sweat from my underarms. Socially, I'm able to go out and feel free to wear whatever I want, and I'm much happier of a person. I think Dr. Braun's a wonderful doctor. I was right from the beginning when I looked him up and I read all I needed to read about him. And he's funny, he's friendly, and it's just he makes the procedure that much easier. I'm very happy with choosing him. I've been telling all my family and friends about it. It's an amazing procedure and it really works. It was very simple. I'm just on top of my world. The results have been amazing. I don't ever remember a time when I didn't feel that I was sweating more than anybody else. I no longer have any sweat from my underarms. Socially, I'm able to go out and feel free to wear whatever I want, and I'm much happier of a person.
To ask Dr. Martin Braun any questions about hyperhidrosis, visit www.healthspot.tv.